Hello, good morning. This is Abdullah Al Mutawakkil, and this is the second episode, and we will talk about the rest of urolithiasis, um, calcium. In the previous episode, we talked about calcium oxalate crystals, and today we will talk about struvite crystals. And if we have a spare time or enough time, we will talk also about urate crystals. Um, as a general reminder, in the previous episodes, we talked about calcium oxalate crystals, and um, I told you that it always forms uh, in acidic urine, and we must convert the urine into alkaline medium, um, just to prevent further accumulation of calcium oxalate. It cannot be dissolved. Um, and let's start with screen sharing here. Okay. Now you see struvate. Now you see struvate crystals. Okay. Struvate crystals or struvate stone is a urinary tract stone that composed of magnesium ammonium phosphate. It's also called triple phosphate crystals or triple phosphate stones. It's maybe the most common urolith in dogs and cats. Um, Despite the fact that it formed in dogs resulted from urate producing bacteria that convert urine into alkaline media, which facilitate the formation or aggregation of those crystals to each others in order to form struvate stone. However, in cats, we consider the dietary deficiency of high quality protein or excess amount of magnesium inside the cat or feline diet is the main or the cornerstone pathogenesis in formation of struvate stones or struvate crystals. Okay. And the risk factor also, as I mentioned before, I don't like to be to sound like a broken record. However, Staphylococcus or Enterococcus or even Proteus bacteria is considered as the main causes of urinary tract infection and struvate crystals. Also, highly concentrated urine, like in summer, when cat or dog maybe forget to drink enough or sufficient water in order to dilute his urine, it's also considered as a risk factor or a predisposing cause in order to form those kind of stones. Okay, the clinical presentation, as we mentioned in the previous episodes of pet animal medicine for curious minds, I told you that owner will come into your clinic, and his chief complaint is that his animal suffer from hematuria, plaquuria, or even dysuria, crying while urination, or an appropriate urination pattern dog or his cat urinate in random areas around the house, and it may be enter and exit the litter box frequently during the day, with a short time apart between every single attempt to urinate. Physical findings or physical examination, you will find out that this animal has enlarged urinary bladder, like orange or lemonade size urinary bladder, and it's really painful. Every light or mild palpation on kidneys, it may elicit pain for the animal. Okay. In cats, you will maybe find that urinary bacterial culture is sterile, and this support the thoughts that the thought of that this struvite crystals in cats especially and mainly resulted from imbalance in its diet. High magnesium diet, low quality protein diet for cats can produce this kind of crystals. Okay. Diagnosis. This is maybe a general rule or a general consideration that you must take into account. You must take history from a pet owner, and after that you must conduct your physical examination, full physical examination. After that you must perform ultrasonography just to rule out any large stone inside the urinary bladder that may require cystotomy operation. And if it's not occur, you must perform or introduce a catheter, urinary catheter, in order to relieve the obstruction. Also, you must take a sample via cystosynthesis or from the catheter in order to perform or conduct urinalysis, just to know what's going on with this urine, and what's the type of these crystals. Also, you have to measure potassium level in this patient, because there is a common finding in maybe a major amount or a major population of feline lower urinary tract obstructive patients or obstructive dogs, that they might have hyperkalemia, and you have to measure the potassium level in order to early intervention against this issue, hyperkalemia, maybe via saline administration intravenously, or maybe calcium gluconate, or maybe glucose administration, dextrose IV, or maybe as a final step, you have to have a control on this state by injecting intravenously hypertonic dextrose solution combined with regular insulin. So serum biochemistry will exclude, rule out, or rule in the hyperkalemia. Don't be panic if you notice that creatinine level or blood urea nitrogen level is going through the roof in these cases, because you have pre-renal azotemia in this case, post-renal azotemia in this case, resulted from outflow obstruction of urine. The urine will retrograde into the renal pelvis, and it will increase, this process will increase the level of creatinine and blood urea nitrogen tremendously. So don't be panic if you find this high level of creatinine and blood urea nitrogen. And after that, and after maybe after identification of the exact type of those crystals, maybe calcium oxalate, struvite crystal, or ammonium biurate crystals, or any kind of crystal, you have to follow chronic treatment for this crystal and regular urine analysis in order to evaluate the treatment plan. Okay. You will find under the microscope struvite crystals as this shape, a triangular shape with maybe a rectangular shape with this triangle and this triangle, and maybe this line that connect those triangles. And you must know that struvite crystals considered as radiopaque structure inside urinary bladder, so you can find it easily if it's stone or big enough to appear in on X-ray. Chronic treatment. The goal of chronic treatment are urine pH lower than 7. You have to convert the urine into acidic medium in order to make those crystals dissolved, and the urine specific gravity of 1.010 to 1.020, and the negative culture if there is bacterial infection. Dietary therapy also is crucial for sterile struvate urinary stones, as I mentioned before, because as I mentioned before, it always formed resulted from imbalanced diet. Okay. Urinary acidifiers are seldom required if the pet is eating an appropriate diet and urinary tract infection is eliminated. What kinds of urinary acidifiers you can use? Methionine, you can use vitamin C. All those will be beneficial in order to convert urine into acidic media. If there is no improvement is seen on radiograph after 4 to 8 weeks, cystotomy will be indicated, and repeat radiograph every 2 weeks during medical distribution to evaluate the size of this stone, these stones. Okay. Repeat also urine analysis every week after initiating medical distribution therapy. and this to ensure, and you have to do this to ensure that pH between 6.5 to 7, which is acidic urine, in order to allow this crystals or these stones to to be dissolved, and also the specific gravity between, as I mentioned before, 1.010 and 1.020 for dogs, and in cat 1.030 to 1.040 in cat. Prognosis is good, and the recurrency is common. You have to tell the owner that if he continued uh, providing, if he continue providing bad quality protein or bad quality dry food to his pet, this issue will be repeated, or will be reoccur. Okay. Prevention. If urinary infection can be eliminated, long-term diet change is not necessary. As long-term diet that convert urine into acidic medium might be a predisposing factor to form another type of crystals like calcium oxalate, as I mentioned before in the last episode, in the previous episode. Okay. And now we will talk about urate crystals, which is really common in Dalmatian dogs. And some authors cited that it's maybe considered as a normal finding in cats. However, I would believe that you have to check out the liver from any disorder or from any disease, because a high ammonia level will be accumulated with uric acids and its salt and form urate uroliths. Okay. You have to figure to exclude hepatic cirrhosis, portosystemic shunt, any urate producing bacteria, any urinary tract infection, any liver disease. Okay. A clinical presentation, as I mentioned before, however, it may be combined with hepatic encephalopathy or hypoglycemia, or maybe seizures, or maybe any kind of hepatobiliary disorder, like biliary sludge, acute hepatitis, hepatic lipidosis, any kind of hepatobiliary disorder. Also, urinary tract obstruction is also common as a presentation for this issue. Please give me 1 minute and I will get back. I'm really of this interruption, but the battery running out. Now I connected the charger. Okay. Diagnosis. In contrast to calcium oxalate crystals or calcium oxalate stones and Struvite stones, urate crystal considered to be radiolucent urolith, you will not have the ability to observe it on an X-ray film. as initial database, you will find that CBC, complete blood count, is unremarkable in those cases. Serum biochemistry profile, you will find azotemia, absolutely, as I mentioned before, it's post-renal azotemia. You might find hyperkalemia and metabolic acidosis if the obstruction is present. Urine analysis, you will find aciduria and urate crystals. Abdominal ultrasonography, you might find only turbidity inside urinary bladder, maybe echogenic urine. You might find cystitis, increased thickness of urinary bladder. You might find some abnormalities on liver or pillary system during abdominal ultrasound examination. As an acute general treatment, firstly, you have to relieve the urinary tract obstruction. And if any hepatic encephalopathy is present, you have to treat it really fast in order to save the state of this animal, the health state of this animal. You have also to treat the urinary tract infection if it's present. Yeah. Chronic treatment. The cornerstone in chronic treatment of urate crystals is allopurinol. Allopurinol is a life-saving drug because it prevents conversion of hypoxanthine into uric acid as a final product. So it decreases the amount of uric acid and the urate crystals by the time. You have to promote water consumption by administering water via syringe. You have to tell the owner to provide sufficient amount of water for his pet, and you might advise him to offer canned food and wetting dry food, like a cup of dry food and half cup of water, and mix them all together and offer them to the pet. Yeah. Also, you can add alkalizing agent, the products that make urine more alkaline, like sodium bicarbonate or potassium citrate, to the diet or to the water. If you have the ability, or you have you can advise the owner to follow to make his pet follow chronic kidney disease diet, like royal canine renal diet, or vegetarian formula, handmade or homemade vegetarian diet. Possible complication: low protein diet or vegetarian diet may be considered as a predisposing cause for taurine deficiency, which lead to dilated cardiomyopathy as a final sequelae. Also, severely protein restricted diets are inappropriate for growing or pregnant or even lactating animals. Recommended monitoring by urinalysis every 2 weeks after diet change to achieve the goal of pH, alkaline pH, and the specific gravity lower than 1.020 and absent of crystals. This is your goal. Prognosis for the solution is fair. Recurrency also is common, and cat with urate have underlying hepatic disease less commonly than non-Dalmatian dog. This is its shape under the microscope. It's pigmented with maybe hooks around it. So hyperkalemia and post-renal azotemia. You will find that hyperkalemic ECG, you will find inverted R and very tall T wave, inverted R and very tall T wave. Firstly, it might begin as absence of P wave or widening of R wave, positive R wave, and a tall T wave. But as an advanced complication of hyperkalemia, the ECG will convert it like this pattern, inverted R, wide R, inverted, and tall T wave. Okay? You can treat this issue by normal saline or calcium gluconate or isotonic dextrose or hypertonic dextrose with regular insulin, but you have to have wisdom in order to choose the precise or the required treatment for this case. If it's slightly elevated, only normal saline or calcium gluconate carried on normal saline will be sufficient. But if it's maybe moderately high potassium level, you might need isotonic dextrose because there is a normal process of the body to introduce the glucose inside cell carried with potassium levels. So the potassium will be reduced during intravascular space because it introduced into intracellular space. And if this process is slow, you have to inject intravenously hypertonic dextrose, 25% dextrose, and regular insulin at the same time in order to accelerate this process. And here's the case. This is Tico. Tico is cat suffered from lower urinary tract obstruction, and the potassium level here is 13.36, and it's maybe a twofold increase from the above the normal level. And after administration of isotonic glucose level with maintenance dose, it reduced to 8.5, but after injecting hypertonic dextrose and regular insulin, it reduced into normal level 4.7, and this is the video that describe the case of Tico. Hematuria, as you see in this bottle, and it connected to monitor the normal ECG is appeared here, PQRST vertically, and now he's completely fine and completely alive. This is the pseudomembranous cystitis and the echogenic urine inside the urinary bladder of Tico. Thank you very much. And if you have any question about this episode and the previous episode, I'm so welcome to answer all your questions. Please leave your comments below, and if you do subscribe or like, I will be appreciated. Thank you very much, and see you next time.